right. Yeah, we're in the school pickup line again. Okay, so on this previous post, somebody asked, it was a post about breast implants. So if you have some sag, but you add enough volume, can you get away without doing a lift? And it's kind of a complex question. I see a lot of patients who have lost a significant amount of weight. And there's always some ptosis, which is droopy tissue. The question is if that's due because, if there's ptosis because there's a lack of volume now and you just have kind of empty skin and more skin than there is for the breast volume, or because there's actual ptosis of the breast tissue. And it's kind of a fine line. I measure how much tissue is hanging below the inframammary crease, and past a certain amount, I know people are going to need a lift. If it's less than that, generally adding volume is all you need because you're just filling that skin back out. But again, it's a little bit of an art form, and there are discussions I've had with patients where it's like, you could probably benefit from a lift, but if you really don't want it, we'll just let the implant sit a little bit lower. So you can't lift breasts with an implant. You can fill out an empty tissue envelope, if that makes sense. But if the breast truly needs a lift, then you need to lift it even with the implant in place, or you end up with an implant that's too low or breast tissue dropping off the implant. Does that make sense?